actually been a breast surgeon for 20 years. I'm a surgical oncologist, so I do treat other diseases besides the breast. I had my own personal yoga practice, and over practicing off and on for many years, I found that the last teacher that I had was sprinkling in more of the philosophy of yoga as well as mindfulness, and I found a lot of personal, mental, and physical benefits from the practice. And I thought to myself, this would be really good for my patients. So I actually learned to teach yoga for my surgical patients, not for the physical benefits as much as I did for the actual mindfulness and the mental benefits. And using yoga in my surgical practice, it's changed the way I practice for sure.
With your opinion, with yoga, knowing the movements, what is it about the Lat Dorsi that you find restricts, what tasks it restricts?
It restricts many tasks because we do planks a lot in yoga, what we call kumbhakasana, which is part of the sun salutation. So if you're in a plank and you're trying to engage those muscles, so you're engaging the latissimus muscle. So when we do the reconstruction, you're not using the entire latissimus, but you are weakening it. Okay, you take enough of it where you weaken it. So that move, just holding a plank or doing a push-up, can be quite painful or weakened. But I think more significant is the latissimus dorsi muscle attaches the torso to the lower body. It's one of the few muscles that actually goes towards the lower body. And when you weaken it, you can actually, over time, that can affect the patient's gait. So as you can tell, there's so many different options, from starting with how you manage the actual cancer to how you preserve function and how you give the woman the best cosmetic and aesthetic outcome. And hopefully you can achieve all three, but it goes in that order of priority: getting rid of the cancer, maintaining function, and then cosmesis. So I think sometimes we get the order backwards a little bit, and we go for cosmesis and we forget about functionality. And some of the things we do to patients, we can't undo them. Well, I have a 8-week mindfulness program, which is based off of the work of John Kabat-Zinn. So the 7 pillars of mindfulness, and I present them to the patient over 8 weeks in a specific order, starting with acceptance and then ending with beginner's mind. So just changing their perspective and looking at breast cancer as an experience and not surviving the experience. So yes, you can die from cancer, but the reality is we're all going to die. You're going to die, Denise. I'm going to die of something. We don't get out of this life alive. So really helping them to live fearlessly.